What if you could restore your body's natural strength and energy in just 60 seconds a day using nothing more than your own hands? Imagine waking up with the kind of vitality you haven't felt in years. No pills, no expensive treatments, no awkward doctor visits, just your body working the way it was designed to. Stay with me, because in the next few minutes, I'm going to reveal one simple technique that helps awaken your body's natural circulation systems, support hormonal balance, and strengthen the key muscles that maintain vitality and performance. I'm Dr. Grace Miller, a urologist with over 20 years of experience helping men restore their energy and confidence as they age. And today, I want to show you a powerful science-backed approach that takes less than 1 minute to perform, but can bring noticeable results when practiced consistently. By the end of this video, you'll know exactly where this technique works, why it's so effective, and how to perform it safely and correctly for the best results. But first, let's understand why it works. Understanding the root cause. As we get older, many men start noticing changes they didn't expect: lower energy, reduced strength, slower recovery, and sometimes a gradual decline in physical responsiveness. It's easy to assume this is just aging, but the truth is more specific. Your body relies on 3 interconnected systems to maintain performance and vitality: the nervous system, which sends arousal and controls signals from the brain; the circulatory system, which delivers oxygen and nutrients through blood flow; the muscular system, particularly the deep pelvic muscles that support function and stability. When all 3 communicate efficiently, everything works smoothly. But with time, these systems can lose coordination. The signal pathways slow down, like static on an old radio line. Blood vessels lose flexibility, restricting proper flow, and muscles, especially those deep in the pelvic area, lose tone and strength from years of underuse. This combination leads to reduced circulation, slower responses, and less stability. But here's the good news. Your body isn't broken. It just needs help reactivating what's already there. The science behind circulation activation. For centuries, traditional medicine has used gentle pressure and targeted stimulation to restore circulation and nerve balance. Modern science now shows why these ancient techniques actually work. When specific areas of your body are stimulated correctly, it triggers what's known as a neuromuscular reflex, a natural communication signal between your nerves, muscles, and blood vessels. Think of it as flipping on a dormant switch. These signals help open small blood vessels, relax tight tissue, and activate dormant muscle fibers that are essential for healthy pelvic performance. This kind of stimulation also encourages oxygen-rich blood to move through areas that have become stagnant over time. Better circulation means more nutrients, more energy, and faster recovery. It's not about forcing your body, it's about reminding it how to perform naturally, the way it used to. The hidden power zone. There is a small area of the body that acts as a control hub for pelvic health and vitality. It's located between your lower abdomen and upper thighs, containing a network of blood vessels, nerves, and muscle fibers that influence everything from circulation to hormonal balance. When this zone becomes tight or understimulated, which is common due to prolonged sitting, stress, and age-related changes, it can restrict flow and weaken nerve signals. Gentle, consistent stimulation helps release that tension, reactivate circulation, and strengthen the underlying muscles that control performance. In short, this area is the command center for your pelvic function. By giving it proper attention, you can restore strength, balance, and natural responsiveness. How to perform the technique? Let's walk through the process step by step. It's simple, safe, and takes just 60 seconds a day. Step 1. Get comfortable. Find a quiet, private place where you can relax without distractions. Sit in a chair or lie on your back with your knees slightly bent. Take a few deep breaths and allow your body to loosen up. Step 2. Identify the target area. The goal is to focus on the soft region between your lower pelvic area and upper thighs, where your body's main circulation and muscle pathways intersect. Step 3. Apply gentle pressure. Using your fingertips or knuckles, apply gentle, steady pressure to this area. Think of it as pressing a firm but sensitive button. You want to engage the muscles beneath the skin, not just the surface. Start with light pressure and gradually increase as your body relaxes. Step 4. Circular motion. Move your fingers in small, slow circles clockwise for about 30 seconds, then counterclockwise for another 30. Maintain steady pressure and focus on your breathing. You may start to feel warmth or a subtle pulse beneath your hand. That's a good sign of increased circulation. Step 5. Deep breathing. Inhale through your nose for 4 counts, hold for 2, and exhale through your mouth for 6. This breathing rhythm helps your body relax and amplifies the effects of the massage by encouraging blood flow and oxygen delivery. It's 60 seconds total. Building the routine to get the best results. Consistency is everything. Perform this technique twice daily, once in the morning and once before bed. The morning session wakes up your pelvic region, improves circulation for the day ahead, and helps activate your energy naturally. The evening session relaxes your muscles, clears tension, and supports overnight recovery. Some men also find it beneficial to practice before exercise or any activity that requires strength and focus. Over time, this consistent routine helps retrain your muscles and nervous system to respond naturally, improving both confidence and control. What to expect within the first few days? Many men notice subtle changes: slight warmth in the pelvic area, a sense of improved circulation, or better posture and comfort. By the end of the first week, you might begin noticing stronger energy and more responsiveness in your body's natural reflexes. By weeks 2 and 3, improvements often become more noticeable: better control, stronger pelvic tone, and a renewed sense of balance and vitality. By the 4th week, most men describe a genuine transformation: clearer energy, improved strength, and more consistent physical performance. Everyone's progress will vary, but steady, daily practice creates the foundation for long-term improvement. Advanced optimization tips: once you're comfortable with the 60-second basic technique, you can enhance its benefits with a few subtle refinements. Think of these as optional upgrades rather than requirements. 1. Mind-muscle focus while applying pressure. Consciously tighten and release the surrounding pelvic muscles. This activates your body's neuromuscular memory and strengthens deep muscle fibers that often remain dormant. 2. Temperature contrast after each session. Place a warm towel over the lower abdomen for 1 minute, then briefly switch to a cool compress. The contrast helps expand and contract blood vessels, improving vascular flexibility and recovery. 3. Postural alignment. A large part of pelvic restriction comes from poor posture. Spend a few minutes standing tall, rolling your shoulders back, and engaging your lower core. Proper alignment prevents the compression that limits circulation in the first place. 4. Hydration and minerals. Circulation depends heavily on the viscosity of your blood and the balance of electrolytes. Drink enough water and include foods rich in potassium and magnesium like bananas, spinach, and nuts to support smooth flow. 5. Gentle mobility work, light stretching of the hips and lower back complements the technique. Yoga poses such as bridge, cobra, or butterfly naturally open up the pelvic area and reinforce the benefits of daily stimulation. Safety and common questions: is this technique safe for everyone? Yes, when performed gently and mindfully. However, if you have a recent injury, surgery, or chronic pain in the lower abdomen, consult your healthcare provider first. Can I overdo it? More isn't always better. Too much pressure can cause irritation or soreness. Remember, the goal is activation, not force. Consistency and relaxation are far more effective than intensity. When will I see results? Most users report feeling subtle changes within the first week and noticeable improvements within a month. However, results depend on your current health, consistency, and supporting lifestyle. Should I stop other treatments or medications? Never discontinue prescribed treatments without medical advice. This method is complementary. It supports your body's natural systems but should work alongside, not replace, professional care. Supporting habits for maximum results. The 60-second technique is powerful, but its effects multiply when paired with a few simple lifestyle adjustments. 1. Daily movement. Aim for at least 20 to 30 minutes of moderate physical activity each day. Walking, swimming, or cycling stimulates blood flow and strengthens cardiovascular health. 2. Stress reduction. Chronic stress constricts blood vessels and disrupts hormone balance. Practice mindfulness, deep breathing, or meditation for 5 minutes daily to calm your nervous system. 3. Balanced nutrition. Eat a diet rich in whole grains, lean proteins, healthy fats, and colorful fruits and vegetables. Foods high in antioxidants, like berries and leafy greens, help protect your vascular system from damage. 4. Limit alcohol and tobacco both can damage blood vessels and decrease circulation efficiency. Reducing or eliminating them accelerates your progress and improves overall energy. 5. Sleep and recovery. Your body repairs itself during rest. Aim for 7 to 8 hours of quality sleep nightly. Consistent rest keeps hormone levels balanced and supports long-term results. The 30-day challenge to help you stay consistent. Follow this simple 30-day plan. Week 1 activation. Perform the 60-second technique twice daily. Focus on proper form, gentle pressure, and breathing. Note any early changes: warmth, ease, or lighter posture. Week 2 strengthening. Add the mind-muscle focus step. Begin tightening and releasing your core muscles during the session. Keep daily notes of how your body feels. Small improvements matter. Week 3 integration. Incorporate one supporting habit each day: more hydration, stretching, or deep breathing. These microchanges create momentum and amplify results. Week for transformation. By now, your circulation pathways are more active and your energy levels more stable. Continue with your routine and add one rest day each week to avoid fatigue. At the end of 30 days, reflect on how your body feels stronger, lighter, and more responsive. That awareness is the foundation for maintaining lifelong vitality. Why this works? You might be wondering why something so simple can be so effective. The answer lies in biology. The pelvic region houses a dense network of nerves, vessels, and connective tissues that influence many core functions: mobility, stability, and even confidence. When circulation is restricted, everything downstream suffers. By using deliberate touch, controlled pressure, and focused breathing, you awaken dormant pathways. The body remembers what optimal flow feels like. Over time, this new pattern becomes your natural state without external aids or medication. It's the difference between forcing performance and restoring balance. Once the balance returns, everything else follows naturally. Mindset matters. Physical health and mental perspective are inseparable. Many men approach improvement from a place of frustration, wanting immediate, dramatic results, but your body thrives on patience and consistency, not stress. View this practice as self-care, not a chore. Each session is a minute of reconnection, a chance to tune into your own biology and remind yourself that strength and vitality aren't lost. They're simply waiting to be reawakened. Celebrate progress, no matter how small. The warmth you feel, the calm after breathing, the steady improvement — these are signs your body is responding exactly as it should. The bigger picture beyond physical benefits. This simple technique has emotional rewards. As circulation improves, your energy rises. As your energy rises, so does your confidence. You begin moving differently, thinking differently, living differently. When your body feels balanced, your mind follows. Tasks become easier, motivation returns, and your overall outlook brightens. That's the real goal, not just stronger muscles or better performance, but a complete sense of well-being. And it all starts with one mindful minute each day. Final thoughts from Dr. Grace Miller. Over the past 2 decades, I've worked with thousands of men who believed their best days were behind them. But time after time, I've watched those same individuals rebuild their strength and vitality using simple, consistent practices like this one. Science confirms what experience has always shown. The body is remarkably capable of renewal. When you give it attention, movement, and oxygen, it responds often faster than you expect. So today, commit to your first 60-second session. Don't wait for perfect timing or ideal conditions. Just start, because the moment you take responsibility for your own health, everything begins to change. You already have the tools you need. Your body knows the path. All it asks is that you listen, breathe, and move with intention. I'm Dr. Grace Miller, and I hope this guide helps you rediscover the natural strength that's been within you all along. Remember, consistency builds confidence, and confidence builds vitality. 1 minute at a time.